October is Breast Cancer Awareness Month, so it's nice to have a special guest today who is a two-time survivor doing something in Atlanta that no one else is doing. Welcome, Jill Binkley. How are you?
Good. Thank you very much for having me.
Glad to have you. Now, your occupation is?
I'm a physical therapist.
And you formed My Turning Point.
Correct. We started Turning Point in 2003, a couple of years after I went through my first round of breast cancer.
Well, so tell us your story.
I was diagnosed with breast cancer when I was 42, 3 kids under 12 at home.
Oh, goodness.
And so it was quite a huge impact. I'd been healthy. I exercised, no family history. Quite a shock to be told that, yes, that mammogram comes back positive. And so I went through breast cancer myself. My husband and I, both in the healthcare community, healthcare world. And I went through surgery, chemotherapy, radiation. But what was probably most surprising, stunning to me was the number of physical and emotional side effects of breast cancer treatment. And even though I was in the healthcare field, I had no idea about the impact on women going through breast cancer.
And I don't always really, as a doc, I don't always think about rehabilitation. You know, because I've dealt with head and neck cancer before, and we don't. So every specialty evolves. So apparently rehabilitative medicine has evolved as well.
We're working on evolving it. It is really just in its infancy. An analogy I use, if someone had knee surgery, the person themselves, the patient themselves, and their orthopedic surgeon would know that they're going to go to physical therapy
Absolutely.
after.
That's what I think of.
But that doesn't happen in the oncology, the cancer world, not just breast cancer, but all cancer patients. And as a physical therapist going through breast cancer, that's when I realized the role that we could play with physical therapy, exercise, massage therapy, counseling. All of these things were really services that were not being applied in the breast cancer world.
You would think that what you're doing is very popular and that most people would know about it. Are you really busy? I mean, you're seeing more patients than you can possibly see?
We are at this point. We're very busy, but it was a slow start because of what I mentioned in that most of the medical community, doctors, nurses working in the oncology field, it's just not on their radar. And so we've been now 11 years at Turning Point, and we have worked tirelessly to really spread the word. And so now at this point, I would say most of the doctors in the greater Atlanta area that are dealing with cancer patients, breast cancer patients, know about Turning Point. It's still kind of a struggle to get it on their radar from the point of view of every woman needs to be referred.
Absolutely.
That sort of standard of care, automatic
Right.
referral.
Well, you would think that anything that could help support anybody going through breast cancer would be important. And that's what you do. It's very supportive. So tell us how it evolved.
Mm-hmm. We started very small with a small clinic in Alpharetta, and we were in Alpharetta really just because we had space that was donated to us to get us started, which was great. Started with 2 people, Renee Vaughn, who's still our administrator all these years later. 2 of us started and basically evolved it. We just moved recently to be more accessible to the greater Atlanta community and including MARTA so that people could get to us. We're now at Northridge and 400, so we're at least a little more central. We have a great new clinic that we moved into last year. So we're a freestanding community clinic. We're a nonprofit. So we are able to see all women regardless of their ability to pay through donors and grants.
Great.
As I mentioned, we have physical therapy. We have massage therapy, counseling, a dietitian, exercise classes, a Pilates class, a yoga class, all provided by healthcare rehab providers who are expert and specialized in the field.
I looked at your website, and everybody should look at it. It's called myturningpoint.org, myturningpointaltogether.org. You've got a vast staff. I was really impressed, great board of directors and people providing this care. Tell me, what's a typical day for somebody coming in to your organization?
When a woman is referred, the most common time we see women are within a couple of weeks post-op. That's our ideal time.
Okay.
But they may come at that point up to many years later. So a woman would be seen first by a physical therapist just to sort of get that general, what their needs are, what's been going on with them, and get started typically with physical therapy. From there, they would branch out as needed, may see our counselor, may see our dietitian, not all in one day, but gradually over the period of a few weeks or a month. The person may join one of our exercise classes when they're ready, post-operatively. So we have a lot of our women are, accessing several of our different services. We also have monthly education programs and different topics done by our professional staff, and they range from sexuality after breast cancer to topics like lymphedema, which is swelling of the arm that is one of the side effects of treatment in some women. So a wide range of topics. We do them monthly, and they're free of charge. And so we're trying to educate women.
You have groups as well as individual therapies.
Exactly. We have groups of these education classes and exercise classes. We also have special programs and a support group for women with advanced breast cancer.
Wow, that's great. Once again, we're talking to Jill Binkley, the founder of My Turning Point. So how are you funded? I mean, does insurance pay for this? People pay out of their pocket?
We bill insurance for physical therapy, and we do still find some women uninsured and underinsured.
Well, what happens to them?
Those women would be on our financial assistance program with a
So you
sliding
see them?
scale. Absolutely.
Wow, that is great. You'd think anyone with breast cancer would be a part of this. So I'm glad that you're here and we're talking about it. Again, what are your needs?
As you mentioned, we do see women regardless of their ability to pay, and we do have a lot of complementary programs. So part of our funding is our health insurance building. That's about a third. The other 2/3 of our funding are grants. We have grants from Susan G. Komen Atlanta, the
Great.
Atlanta Today, Walmart. So we have some big grant funders, but that's always a need. We also have corporate partnerships. Athena Water, for example, is one of our corporate sponsors. And then the other big portion is donors and fundraisers. And it's interesting because our largest part of our donor pool is former patients who really are trying to pay it forward so that other women get this care.
That's great. Did you notice I'm wearing pink today?
I
Everything's
love it.
going to
That's
be pink.
great.
Doc Talk is going pink all month. And so, this is a cause everybody can get behind. But I got to tell you, I didn't know about your organization till this past week when Vicki brought it to me. So I'm excited about this. So people can get in touch with you regardless of if they have breast cancer, then you will take them in. How long did they stay in the program? I mean, is there a graduation period?
There's
time?
sometimes a graduation period. A woman will be obviously finished perhaps with fairly acute, physical therapy after their surgery. But we also have a lot of women who will come back years later for massages, for our education programs, as volunteers at some of our fundraising events. We do a golf tournament, and we do a fundraising event called the Pink Affair in March. So women will come back and support that. So they're often remain linked in.
That's great. And so what are the festivities going on to raise money in October?
We have October is an interesting time for us. It's the beginning of our annual fundraising campaign. So we do a direct campaign for fundraising. We also do a lot of educational talks in October. It isn't one of our big fundraising times, although there's a lot of community events, grassroots kind of fundraising events that go on in October to support Turning Point. But our focus in October is typically kind of getting the word out, both to healthcare providers and women, that we're around and that we can help them through their journey. And
in the last minute we have here, what would you like our listeners to know about your organization?
I'd like them to know that they may have a family member, friend, coworker who may have gone through breast cancer or is going through breast cancer, and they probably have some physical and emotional side effects that Turning Point can help. And certainly we appreciate any support that the community can give to our cause.
Well, we appreciate you being here this morning, Jill. Fantastic.
Thank you so much.
Thank you. Also want to thank my guest, Dr. Monroe from the CDC, who talked about Ebola, and Cindy Gatton, patient advocate. That's all the time we have for today. I hope you have a great rest of the weekend. You're listening to Doc Talk with Dr. Jeffrey Gallops on Talk Radio 640 WGST.